Hello everyone. You're probably watching this video because you have a hernia. Most commonly, people have inguinal hernias, umbilical hernias, or incisional hernias. If you have one of those, then this is the video for you to watch. If you have a different type of hernia, this is also the video for you to watch. Um, you're probably thinking about finding a surgeon, right? Because you have a hernia, and most primary care doctors, want their patients to see a surgeon just to get all the information. Of course, there's a lot of information online. First of all, I'm not going to repeat what a hernia is because there's plenty of resources out there to explain what a hernia is, how it starts, what are the common symptoms, etc. What I really want to help you is dive into how to find a hernia surgeon. Because I don't think that is really talked about much online. You can go to Reddit and dive, go down a rabbit hole and go into those details. But I'm going to talk to you as a experienced hernia surgeon and kind of talk to you about my perspective about this whole thing. I've been in practice for 20 years, and I've seen a lot of patients with complications from hernia surgery, recurrences, etc. You can say I'm a very specialized hernia surgeon, that all the surgeons refer their complex patients to me for. Even the big academic centers refer a lot of the most complex patients to me because I can tackle a lot of those patients with minimally invasive surgery, with robotic surgery, without the need for open surgery and the disability that comes from it. But because of my experience in seeing these patients, I know a lot about how patients end up in that situation. And I like to spend a lot of time with my patients when I see them. And I'm genuinely curious, but I'm also I also try to understand how these complications occur and how patients end up with 10, 12 hernia repairs and still have a hernia. And I usually start by going way back to when they were diagnosed with a hernia. Maybe they notice a bulge, maybe they got a CT scan that mentioned a hernia, maybe they had pain. And usually the first thing that they do is they go online and search hernia symptoms and stuff like that. And then they go to their doctor or their friend who's a doctor and get referred to a surgeon or are told that they need to see a surgeon. So then how did they find a surgeon? I think most patients are referred by their primary care doctor to their local surgeon that their primary care doctor knows. Some patients do go searching online for a hernia specialist, but I would say very few patients actually search online for a hernia specialist, which surprises me because hernia is not a very urgent matter. It's not like cancer where you need to get your surgery or treatment done right away. There's time to find a surgeon who is good at what they're doing. But surprisingly, most patients just go to whoever they are referred to or told to go see. And then, how did they develop confidence with that surgeon? And surprisingly, most patients kind of just go along with the first person that they're referred to. The surgeons, they always seem nice and they always seem capable. There's always a board certified, a board certification certificate hanging on the wall. Their office staff seems to be nice. Maybe there's a couple of Yelp review if they decide to go looking on Yelp that are decent. So they go along with the surgeon and then they have the surgery that seems very routine. But then, complication happens or a recurrence happens. And so I kind of want to take you back to that initial meeting with the surgeon and kind of dive into that a little bit more. There's so much that I can talk about, and I can talk about this for hours. But I just kind of want you to think about who you're sitting across from and how that person can really alter the course of your life if what happens in the operating room doesn't go well. And I'm not used to talking in this format, so excuse me if I kind of ramble on and talk about a lot of different things. But the bottom line is your surgical outcome, what happens to you after surgery, the speed of the recovery, the amount of pain you have, the chance of recurrence, the chance of complication, really is determined by what happens in the operating room. Okay, what the surgeon does with his hands or her hands, what the surgeon does with the robotic platform or with the instruments if there's open surgery. What happens in the operating room really determines what happens after surgery. So, number one, you should not be basing your decision on how good that surgeon is or whether you should go with that surgeon. Uh, you should not base it on how friendly their staff is, right? Or how, you know, precise or accurate or how informative their pamphlets are, or how clean their office is, or what city their office is located in, right? Or the Yelp review that talks about how wonderful, Dr. So and so is because he has or she has great bedside manner, or what other things do patients look at? Even just like, the phone tree, is the phone tree really complicated or is it very easy to get a person to answer? Things like that. The things that they are important, right? They are setting a good first impression. So I'm not discounting that, because I try to make a good first impression. I have, I think a very informative website. I hire staff that I know are very competent, that can help my patient, that are friendly to patients, that understand that patients are in a very vulnerable state and need help. So yeah, those first impressions are very important. But remember, what happens in the operating room is going to determine what happens after the operation. Okay, so just keep that in mind when you're going across the Google reviews. Yeah, the reviews may be good, but really, if you're going to look at the reviews, dive into what the patients are saying about their operation, right? So a couple of clues as to what happens in the operating room, because there's no way for you to know what happens in the operating room unless the surgeon has surgical videos, which I'll get to that topic later, okay? But just if you don't want to watch surgical videos because they're bloody, right? They're not. It's not for everybody. But there are clues, with the interaction you have with the surgeon, and also what you can find online. So let's go with what you find online, because right now you maybe haven't seen a surgeon. You're just online researching. I would go and look at the reviews. Okay, dive into the reviews and read. Don't just look at the number of stars the surgeon has. You could a surgeon could have 3.5 stars, but could be the best surgeon in the operating room. And maybe that surgeon is in a situation where he just can't retain his staff, right? For example, Oakland, Emeryville, San Francisco is a very expensive place to live. So a lot of staff, they live about an hour and a half away. And as soon as they find a job that pays better than what we pay here, they leave. So it can be hard to retain good staff. So, just because a surgeon has 3.5 stars because, the front office is not the friendliest or not the most capable, doesn't mean that surgeon is not very good in the operating room. So dive into the reviews and read about how that patient's experience was related to the surgery itself, okay? How fast was the recovery? What was the type of surgery that was done? Were most of the surgeries done open? I would say today, in 2026, most hernia surgeries should be done minimally invasively, okay? Unless you have a very small umbilical hernia, something that's 1 or 2 centimeters or less. But an inguinal hernia, a ventral incisional hernia, recurrent hernia, multiply recurrent hernia should all be done robotically. And you also want to see, if you can find out how often the surgeon converts the surgery. Every surgeon can say they do robotic surgery or they do laparoscopic surgery, they do minimally invasive surgery. How often are they actually completing it robotically? You look for those clues. If a patient talks about how their surgery was converted to open, right? That's a red flag because Just like in the old days when we first started doing more laparoscopy and started doing less open surgery, every surgeon billed themselves as a laparoscopic surgeon, but I know that some surgeons converted, 70, 80% of the time, but they still call themselves a laparoscopic surgeon. So you got to be careful. It's the same with robotic surgery. Everybody can talk about how great they are with a robot, how they're a robotic surgeon, but what you don't know is how often they convert. So look for those clues, and then find out, what the patient's recovery was like. Right? Did they have to stay in the hospital many days? Right? With minimally invasive surgery, good minimally invasive surgery, they shouldn't need to stay in the hospital many days. How quickly did they go back to work? What restrictions did the surgeons put on the patient? With good, for example, with a robotic inguinal hernia repair, robotic tap inguinal hernia repair, I tell patients, I'm not worried about the hernia coming back after about a day because that mesh is going to be locked in place. If I put the right size piece of mesh in, and if I overlap the defect well, that hernia is not going to come back. So I'm not concerned about that. I'm more concerned about pain and prolonging the recovery. So I tell patients, if pain isn't an issue, just gradually increase activity. So, I've had patients a week after surgery. I just had one patient do 75 push-ups and then start dunking the ball a few weeks later. I had a patient do cross-country skiing 5 days after inguinal hernia repair. So look for those clues. A surgeon who does very meticulous surgery, minimally invasive surgery with good technique, with speed, will have patients that recover very quickly and are not afraid of recurrence. The typical story that I hear is that the surgeon said, "Oh, do not do anything strenuous for 6 weeks or 3 months because the hernia come back." Maybe something went wrong in the operating room and the surgeon couldn't do a very thorough dissection, so the mesh had to be very small, or the mesh wasn't positioned well, so the surgeon is very afraid of recurrences, or that surgeon has a very high recurrence rate, so really doesn't want a patient to do anything strenuous that could potentially damage the repair. But a good, solid, minimally invasive hernia repair should not come back when it's done well. And so the recovery is purely based on the pain and discomfort. So those are some clues that you can find on the Google or Yelp reviews or whatever review site. You can always go into Reddit and read about more specific details related to a specific surgeon. There are a lot of patients who go into a very, very minute detail about their surgeon, their experience, etc. And you really want to try to figure out what happened in that operating room. Okay, so again, when you read these reviews, read with the mindset of trying to find out what happened in the operating room, and a lot of it will reflect on how the patient recovers. Okay, so that's what I'm gonna end with today, and the next topic I think I'll cover is how to determine how to ask questions with a surgeon sitting in front of you to determine if that surgeon is going to perform the operation well in the operative